Superintendent David O'Rourke, and from the Hamburg School District, as well as representing the Erie Niagara Superintendents Association, we have District Superintendent Mike Cornell. And I want to thank all our friends in the education field as well as the medical field who helped us go as we went along the way to preparing a guidance for the safe return of students in K through 12 schools across Erie County. That includes all public, private, and charter schools. So I want to thank all who helped us. We heard from district administrators, we heard from parents, we heard from teachers, we heard from pediatricians. We heard from so many in our community, and one of the things that we heard is we need to have a uniform guidance so that we know exactly what the rules are regardless of the school district in our county. And that is what we are issuing today. Why are we issuing it today? It's because unfortunately New York State Department of Health abdicated its responsibility and said it's up to the locals to decide what to do with regards to schools. Well, we know what is appropriate for our community here in Erie County, and that is why the Erie County Department of Health has put together a guidance which does include orders for all schools in Erie County, regardless, once again, of whether they are public or private. Before we go into that, I do want to give you just a very quick update. Of course, we are listed in the CDC category of high transmission of cases with regards to new COVID-19 cases in Erie County. The most recent report had us at 103 COVID-19 new cases per 100,000 residents over a 7-day period. We also have hospitalizations at 95 on August 21st, which is basically as high as we were in May of 2021, and not everyone in hospital is 65 and older. It's actually about 50% plus that are under the age of 64, and we do know for the last week we've had 3 individuals that are under the age of 19 or 19 and under in area hospitals for COVID-19. So you could be younger and have COVID-19, you could be older and have COVID-19 and still need to be hospitalized. The full report of information will be provided tomorrow. We're not going to go into the full report that we normally do, but the level of county community transmission, as you see from the CDC map, is bad all over, especially in the south. We still have a few areas that are considered moderate in upstate New York, including in western New York, but it's really bad across the whole country. We see what is happening in school districts that have already opened in the south, including those that do not have requirements in place, where some of those schools are already going to virtual learning because of mass outbreaks of COVID-19 in their communities. And we do not want to do that. The goal, as we said, is to safely return students to an in-classroom setting to ensure the safety of the students, the safety of the teachers, the safety of the administrators and other school staff. Our goal is to return all students to an in-school learning experience for every day of the school year. And the guidance that you are about to see, which I'll give a little overview and then turn over to Dr. Burstein, who will go into it in greater details, is a comprehensive guidance that's based on the CDC guidance as well as recommendations from the American Academy of Pediatrics. It applies, as I've said, to every public, private, and charter school in Erie County. It was developed with input from leaders of the school education community, pediatricians, epidemiological staff, and I will add parents as well. And it is subject to change based on COVID-19 trends or changes in New York State regulations or executive orders. So I want people to understand that this is not a permanent document for the entire school year. It is subject to change based on what we see in the local community, as well as what we may see come down from New York State, or for that matter, national recommendations. So it's very important that people understand that we expect this to change as the COVID-19 situation changes. None of us thought we'd be in the situation we are today, where we have increasing cases, increasing hospitalizations. We thought we would be in a better situation because we all believed that the vast majority of individuals, and especially adults, would get vaccinated. Not all have. And as we know, if you are under the age of 12, you cannot get vaccinated. So for those children who are attending schools who are under the age of 12, they cannot get vaccinated, and we have to ensure their safety, just like we have to ensure the safety of a child who may be 15, but themselves cannot be vaccinated due to a health issue. Our goal is to protect all, and we will modify this if needed as the situation changes. You can go to erie.gov/COVID-19/schools to find the full guidance as well as a summary. What we're going to provide you today is basically the summary. To school administrators, teachers, parents, anybody who's interested, you can go to erie.gov/COVID-19/schools and read the full guidance. The full guidance is what applies. The summary is as it sounds. It's a summary of what the guidance is. So if you have questions, please go to the guidance first. Review the guidance. Later today, the Erie County Department of Health and its epidemiological and school team will be meeting with school administrators through WebEx to go through the guidance in greater detail than even what we will be providing right now. So once again, the goals. The goals to reduce the risk of COVID-19 disease transmission in school settings, to prevent illness in students, school staff, and the community, and to maximize in-person learning. We know that that is one of the most important things that we can do. We heard it from parents, we heard it from school administrators, we heard it from pediatricians. We want children to be in an in-class learning experience for the whole year and to minimize disruption as much as possible for families, childcare, and others. So what are the main mitigation strategies? These will be gone into greater detail by Dr. Burstein. Masking, we'll go into that in greater detail. Physical distancing, health monitoring, return to school following an illness, reporting COVID-19 cases to the Erie County Department of Health, quarantine principles, who will be quarantined, who will not be quarantined, youth sports, vaccination strategies, screening testing. We are offering large-scale screening testing to school districts if they so want to take advantage of it through our Department of Health. Cleaning and disinfection recommendations as well as ventilation recommendations. So I want people to understand this is not just about masks. It's all we're hearing about, masks, 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 masks. This is not just about masks. This is ensuring a safe setting to return students to an in-class learning experience, to protect the students, the teachers, and others, to ensure that our students are getting the best learning experience they possibly can with a one-on-one experience with their teacher in the same classroom, but to do it in a safe manner. And that requires a lot more than just talking about masks. It talks about what are the physical distancing requirements, who will be quarantined, who will not be quarantined, what health monitoring needs to be done, the mitigation strategies that we have here. So with that, I'm going to turn it over to Dr. Burstein. I want to thank her, her school team, the epidemiological staff who put in a lot of time coming up with this very important guidance. 2 weeks ago, we got all surprised when the New York State Department of Health said, it's up to the local departments. We're not going to issue any guidance. Even the New York State Department of Education was like, what? You got to issue some guidance, New York State Department of Health, and they didn't. So we said we need to step up to the plate. We cannot strike out. We cannot walk. We got to get some big hits here. And the thing is, by getting hits that actually matter, by not swinging for the fences, but by what's doing right to protect our students, our teachers, our other administrators and faculty, and the individuals who work in schools, from the bus drivers to the lunch ladies and beyond. And that's what we have here, is a comprehensive guidance to do that. So thank you to Dr. Burstein and your team for your hard work in coming up with a guidance that I believe will be the standard for many other counties and districts across New York State. And with that, Dr. Burstein.
Thank you. Good morning, everyone. And as the county executive mentioned, this is our labor of love. We have worked so hard over the past couple weeks to develop really strong, robust guidelines to make it easier for schools and parents and students to make smart choices to keep everybody safe and healthy, and to obtain our number one goal, keep kids in school to learn in person. So first I'm going to talk about masking. So, because I know that's front and foremost on everybody's mind. However, as the county executive mentioned, this is not the only non-pharmaceutical intervention that we're either going to be mandating or recommending. So we are going to mandate face masks for all indoor activities in schools for children who are 2 years of age and up. regardless of vaccination status. We know that people who are positive for COVID-19, including children, can get infected if they're vaccinated, so we really want to make sure everybody is protected as much as possible indoors while they're on the school grounds and buses. So this also includes buses, where we have seen much transmission over last school year. Masks outdoors are strongly recommended. They're not mandated. However, this is still a good idea to wear your mask outdoors. We have seen transmission among people who are, including people who are fully vaccinated who've been outdoors. Of course, we're allowing for mask breaks. We're recommending about 5 minutes every hour as a maximum mask break. However, many people don't need to take a mask break, and if you don't have to take it, you don't have to. So we're also going to be making strong recommendations about physical distancing. So again, we know physical distancing is a very powerful non-pharmaceutical intervention. However, if we recommend too much physical distancing, not everybody will be able to fit in the classroom. So we're recommending as much physical distancing as possible to get everybody in the classroom and in-person learning. So every school is going to be different, and they'll be able to implement this differently. However, we do want schools to maximize this as much as possible, but not exclude anybody from in-person learning if they want to come to school. And so this includes for students, staff, different situations in sports, band, chorus, orchestra. Busing is very important because, again, the bus driver hopefully has his or her back to the kids and eyes forward to the street, and so won't be knowing everything that's going on. So we really want to make sure that before the bus starts up, everybody is physically distanced as much as possible. And also, cohorting is a very powerful non-pharmaceutical intervention. So we are going to be mandating health monitoring before people walk into the building. We've seen last year and over the course of the summer, people entering schools, people entering camps who have been symptomatic who end up being positive for COVID-19, and then other people get infected or other people have to quarantine. So we are mandating daily health screenings, including temperature checks, before anybody enters the building. And this includes staff, it includes visitors, it includes all students. And then if anybody does become symptomatic while they are in the building, we are mandating that they isolate from everybody else, so they have to immediately go to an isolation room that is mandated to be maintained by each of the schools, and where they have to stay until, if it's a student, they can be collected by a parent or guardian, or a staff member should be excused from school and go home and hopefully get tested and see a healthcare provider. So we do have requirements for return to school after a student or a staff member has had illness consistent with COVID-19 or have tested positive for COVID-19. And those are outlined in our guidance. We also are offering free COVID-19 testing to all Erie County residents who are symptomatic or close contacts. We have a great lab. We have multiple platforms to do PCR testing. And right now our turnaround time is pretty quick, definitely within 1 to 2 days. That might change as business picks up. However, we are offering testing. There is a lot of testing available throughout the communities, the pharmacies, immediate cares. There are pop-up testing sites, so testing fortunately is not a problem in Erie County. However, we are not going to be accepting home-based testing. So if people purchase one of those home test kits for COVID-19 and they run the test in their home, we are not accepting those results for obvious reasons. So we are also mandating that the schools report all the cases that they're aware of that are associated with the school. So if the school finds out that there's a student or a staff member or a coach that is infected with COVID-19, they need to report that to us. And they also have to help us with the contact tracing. They have to look at their rosters, looking the seating charts, and tell us who are the close contacts to that COVID-19 case in the schools to really help us get the job done. And that's going to be true for classrooms, for buses, for sports, for any type of extracurricular activities, band, chorus, orchestra. We really depend on the schools to get us those lists to know who are the close contacts so we're not there. And then the definition of a close contact is consistent with CDC, so we're changing it this year. So instead of, the difference is that for students, if they're within 3 feet of a case, and for adults, so staff, teachers, if they're within 6 feet of a case for 15 or more minutes over a 24-hour period during the time that the case was infectious, is considered a close contact. So that's different from last year. That's different from the New York State guidelines for a close contact. So we've pivoted over to the CDC guidelines for the definition of a close contact. So as the county executive mentioned, we do outline the principles for and policies for who should be quarantined in the schools. And again, this is a mandate. So, and again, we really depend on the schools to tell us who were the close contacts in the schools. So we're relying on the schools. They're mandated us to share that information. Hopefully they will all have seating charts and know who was sitting where and when. So it'll be easy for them to get those lists together. And that includes in the bus. The Erie County Health Department, it is our job to finish off the case investigation and to notify all close contacts that they are in quarantine. So that'll be our job. And then also the who needs to be in quarantine differs by vaccination status and of course proximity and other situations. So we outline all this in our school guidance. But again, just a plug to getting vaccinated if you are eligible. The quarantine guidelines are different for vaccinated versus unvaccinated individuals. So for youth sports, again, we have certain mandates. We are going to require all youth sports, just like in the schools, to inform us if there is a team member or a coach or staff that is positive for COVID-19. And then we include guidance in our guidelines about just explaining when there just needs to be a pause if there's a COVID-19 case. So that means that people that are unvaccinated they would just take a pause from the team from participating in games or practices. However, they can still attend classes, which are the most important. And then when people who are unvaccinated need to quarantine. So we outline that, and so it's very, very clear. However, if a school district or a school decides that for whatever reason that they need to pivot for all virtual learning for a period of time. So during that period of time when the school is only offering virtual learning, the school sports will have to come to a stop during that virtual learning time. Of course, the Erie County Health Department is strongly promoting vaccination in the schools for anybody who is eligible, so that's students or staff. And we have been working with the schools to make sure that everybody has access to a vaccine. We will be offering more vaccine clinics in the schools. We are working with our community health care providers, including our pediatricians, to make sure that they all have a good supply of doses in their offices. And it really makes sense. It not only keeps people healthy, but also they have less requirements for quarantine, and so their learning day, their school day won't be disrupted. And for the parents of vaccinated kids, if they can go to school, again, they don't have to worry about figuring out how to take care of their kids and how to get their kids connected to virtual learning. So again, there are great advantages for many reasons for people to getting fully vaccinated. And then the Erie County Health Department, we're also recommending that school and staff who are not fully vaccinated participate in routine screening at least weekly to identify people who may be asymptomatic and infected, especially during times when we're in high transmission like we are now according to CDC. We are also working with the schools to implement different screening testing programs of, a random sample of 10% of unvaccinated people, or say proximate contacts if there was a case in the classroom, we'd be able to test everybody in the classroom, whether they were close contacts or not close contacts, just to make sure everybody stays safe. As testing is very easy. It's not traumatic. It's not invasive, and it gives us a lot of great information. There's also recommendations for cleaning, disinfection, and ventilation. So, in general, if the schools do a good cleaning once a day, that is sufficient to keep the school safe and clean from COVID-19. However, if there is a case in the classroom, we do recommend that all those spaces where the case was in are cleaned and disinfected within a 24-hour period. I know also we are strongly recommending ventilation. Actually, ventilation is a very powerful non-pharmaceutical intervention that I think in Western New York in the cold climate we haven't really taken advantage of enough, but it is very powerful to prevent COVID-19 transmission. So we're really encouraging schools to maximize their HVAC, to maximize their air filtration system, and also in this classrooms and on the bus, if it's not like sub-zero out, crack the windows open just a little bit. That has just a little bit of the windows cracked open has a great powerful effect of preventing COVID-19 transmission within a closed space. So later today, as the county executive mentioned, in just a couple hours, we are going to be holding a webinar for schools and superintendents and school leaders to make sure and go through these guidelines more thoroughly to help the schools understand what they need to know to keep everybody safe in the school and to help maximize in-person learning. So I'll be joined by my EPI team that has really worked so hard over the past couple weeks to put together these really tight guidelines. And so we'll be sharing that and answering questions from all the school leaders. So I'm going to turn it over now to the county executive for you can ask questions and we can give you some answers. And then we are here with support from our school leadership and our pediatric community. And so again, we welcome questions. Remember, the goal is to keep everybody safe and healthy and to keep in-person learning as much as possible. Get kids in the school. And we all have the same goals. I think we all want the same thing. And we put together these guidelines to help people make safe choices to get there safely and efficiently. So thank you.
Thank you, Dr. Burstein. Before we go into questions, I'd like to give our guests an opportunity to say a few words. We've worked with some of these folks for a while now as we've dealt with COVID-19. First, I'd like to bring up Dr. Dennis Quo from the Buffalo Public School System. The Buffalo Public School System had already announced a mask mandate, but Dr. Quo has worked with, of course, Dr. Burstein for quite a bit of time during this past year to address these issues, and also represents our local pediatric society. So, Dr. Quo.
Thank you. Good morning, everyone. I'm Dennis Quo. I'm a pediatrician. I'm one of the medical directors at Buffalo Public Schools. I first want to thank County Executive Mark Poloncarz, Dr. Gale Burstein, and her team for their issuance of the comprehensive guidance to reopen the school system safely, to be able to return all children safely to in-person learning 5 days a week, and to keep everyone safe as the schools remain open through the school year. Last year was definitely a year which challenged us like none other. We know that kids are best if they are in school. We need them not only to be in school, but we need them to stay in school and to make sure that all of our students, staff, teachers, faculty, everyone associated with the schools are able to continue what we know is best for kids. We also know that it is important to make sure that all of our kids, including the ones who are disabled, ones who are medically vulnerable, are able to be in school, as well as to be able to protect our teachers, staff, again, folks who really work in and around the schools, because they all need to be in school as well. The guidelines that Erie County has issued follow very, very closely to CDC and AAP guidelines. They are comprehensive. We all know that there is not one single strategy that works to keep everyone safe at school. It's multi-layered. We also call it the Swiss cheese model. Multiple things need to be in place in order to keep everyone safe in the schools. These are sensible, they're tested, they worked last year. We believe very strongly that they will work this year. We look forward to a good school year. We look forward to keeping everyone safe and healthy in the schools. And I'm looking forward to having everyone back in a couple of weeks. Thank you.
We'll have our security look into it. Okay, someone pull the fire alarm. Sorry, everyone. We have to evacuate. We will return afterwards with comments from the other.